on that, but truly, we appreciate everything you do throughout the year. It's really incredible. So, our mission here at the board is to support individuals so they can successfully live, work, and learn in the community. And it's because of you and the work that you do that allows so many people to live successfully that way. So thank you. I just wanted to let you know about some of the stuff we've done and what we are going to continue doing throughout the week. So we kicked off the week with a honkathon at 2 different locations in Hamilton. Basically, we just held up signs that said, thank caregivers, thank DSPs, honk your horn and support. So we were on High Street in Hamilton, pretty much in front of Inside Out Studio, and then at the corner of Route 4. And yeah, there you go, Stephen. And then at the corner of Route 4 and North Fair Avenue. So we had people out there for about an hour. We held up signs. We heard a lot of support by way of horns honking. We even had a few people stop their cars and ask, what's a DSP and what is all this about? So not only was it a great chance to kind of toot your all's horn, but also to spread the word about what you guys do and the amazing work you're doing. Additionally, and you may have seen it, we have some yard signs throughout the county that say, thank a caregiver, #DSP Appreciation Week. And then we've got some banners at some other key locations. So just really trying to get the word out about you guys and all the great work you do. And then this week, so we have initiated a new program. It's going to be a DSP appreciation effort. So we want to recognize an outstanding DSP once a month. So we're going to kick that off this month. And the first person that we're recognizing is Tina Otto from ECI. She's done amazing work. So check our Facebook page, our website, our newsletters. We'll have some more information about that on there. And then if you have somebody that you would like to nominate, either in your agency or outside of that, if you know of somebody that's a fantastic DSP and you want to get the word about them out, head over to our website and you can find that nomination form. And then finally, this Friday, we wanted to offer lunch on us, just as a quick thank you again for everything you guys do. So if you want to stop by the JCC between 9 a.m. and 11 a.m., we have coupons for you for Richard's Pizza. And those are good for an Italian steak sandwich or an 8-inch pizza or an Italian or Greek salad. And those coupons expire December 1st. So you have, couple months to cash those in. Like I said, that's 9 to 11 a.m. at the Janet Clemens Center this Friday. So if you are interested in one, you can pick one up for yourself or for any other DSPs who are supporting people in Butler County that are in your agency. So stop by, send somebody over, come and pick those up. And that pretty much concludes everything we've got going on for this week, but also just know throughout the year, we are just incredibly grateful for everything you guys do. So this is our quick little week of appreciation. And we just hope that you know that throughout the year, the work that you do is amazing. And we wouldn't be able to support the people we support without you. So we really appreciate you.
Yeah, thanks, Patricia. It's very true. Thanks for all you do. Very, very excited about this week. If you have any questions on what she had mentioned, reach out and let me know. I'm happy to kind of relay that information to you again if you need it. And just a reminder to stay muted if you don't mind. And then you can unmute if you have any questions throughout the presentation. And then next we have our superintendent, Lisa Giuliano, to talk about COVID relief and staffing crisis.
Good afternoon, everyone, and thank you for your time today. Patricia, thanks for kicking us off. Can everybody hear me? Thank you. Along the lines of appreciation for all that you are doing, there's also recognition for the significant strain that you are experiencing with your workforce. And so we have been working on a couple of things here and sought board approval for them last Thursday night. And I wanted to share some preliminary information with all of you. There will be more information and detail coming out in writing. So absolutely, don't feel like you got to get it all down now, because we are going to be providing you with this information through email. You may recall, I'm sure many of you do recall, that we had some COVID supports in place that last fall for any homes, for providers that were serving people in any homes that were affected by COVID. either an individual that you serve in a home or and/or staff members. And that was a variety of supports that were in place, including a stipend to providers for extraordinary expenses, meals for people in quarantine, personal protective equipment, cleaning supplies, and that type of thing. We were very optimistic and had let those different supports lapse at the end of June because we had not had a need for them for a few months. And unfortunately, because we do have we are experiencing again some positive cases that are affecting our providers, agency, independent, intermediate care facilities. We have had some cases reported. Thankfully, so far, nothing like what we were experiencing last fall, but we want to be responsive to that. So the COVID-related supports are going to be put back in effect. And that is actually going to be retroactive to the middle of August. I think August 19th is the date, because that's when we began to see a reemergence of positive cases. So this Friday, 2 days from now, September 17th, you'll be receiving an email that refreshes all of those COVID-related supports with the correct dates, the form to submit if you have a positive case with a staff member or an individual or an individual that you serve, how to submit it, and then also the details on the other items in case they're needed. If you need to access meals, I know many of you got the information that we have personal protective equipment, and we've been delivering some of that to you. So look for that this Friday, September 17th. And as of right now, we're running that through the end of the year. Not that it will automatically end, but we just wanted to do it so that we could report back to our board in December on how it's going and looking at how the effects have been for those of you who are supporting people affected by COVID. So the next area of grave concern for all of you, primarily because you're working in the midst of it, is the DSP workforce crisis. And for those of you who work in the region, in the neighboring counties as well, our region has been working for the last several weeks on a regional support plan. So the county board superintendent's trying to coordinate what we are offering to providers to help with a variety of things that Medicaid just doesn't cover. And our goal with that was that you wouldn't have to stop and think about, well, what's available in Hamilton, what's available in Montgomery, what's available in Butler, and try to streamline it so that when you are working in our counties, the supports that we're offering look similar. And for those of you, there may be several of you on the call that work in Hamilton County. They rolled out a plan, I think it was last week, that outlined all of the things that they were going to support providers with financially that are not covered by Medicaid. Almost simultaneously, I was having the discussion with my board last week on Thursday night, and they did approve, they did authorize me to spend some funds to reimburse providers for similar needs. So I'm really, I'm kind of torn. I'm happy to announce that we have this rolling out. I wish this wasn't the case, that all of you are working under so much strain with your workforce. However, we do have some supports that are going to be rolled out. This information from Butler County is going to come out next Friday in detail, September 24th. So we're spacing it out just not to confuse the two things. You have the COVID items coming out this Friday, September 17th. And then next Friday, September 24th, there will be an email of information regarding our DSP workforce support reimbursement program. These supports are going to look just like Hamilton County, so that's great. Hats off to our Hamilton County colleagues. They did an amazing job. They are letting us use their forms, so everything can look the same. We will brand them for Butler County. We'll have different contacts, of course. But the financial support our board is offering to spend $1 million between now and the end of the year on these various supports. These funds are funds it's money that we're saving as a board because of the stimulus dollars that we've received during the pandemic. Those stimulus dollars have reduced the cost of our waiver match. So we're spending less money, which means we're saving money. And those stimulus dollars are continuing through the end of 2021. So these are dollars that normally would have come to providers, and this is another way for us to get them to you. So the way it'll work will look very similar to Hamilton County. It will be backdated to September 1st. It will run through December 31st. We'll report to our board in December on both of these support programs, COVID relief, and also on the workforce crisis support plan. Look at what we're spending, what the demand has been, and evaluate how we can move forward with it. Some of the items in there, for those of you who may not be working in Hamilton County, it's DSP, new hire training, a reimbursement of a flat rate per DSP for that. DSP annual renewal training, a reimbursement rate per DSP for that. The DSP longevity add-on, that's helping reimburse you for your direct support professionals to take that 60-hour course that garners an extra $1.56 to each hour billed of HPC. Hotel fee reimbursement for agency providers who have to move DSPs to other locations in order to staff. On overtime, reimbursing the halftime. So you've got your time and a half when people move into overtime, reimbursing the halftime portion that is not covered by Medicaid. DSP appreciation reimbursement. So if your agency spent dollars this week from September 12th through September 18th to recognize DSPs, there will be a reimbursement of up to $25 per DSP. There will be requirements for you to submit some paperwork because, with using taxpayer dollars, we have to really be able to justify and show how we're spending dollars. But we've simplified it. Again, it's the Hamilton template. It's a one sheet where you can, put everything in and send that off to us with any other documentation that is requested, depending on the different area of support. And then we will review it, approve it within 2 weeks. And we're going to have the Southwest Ohio Council of Governments actually pay the providers out of that. It will speed up the process a little bit because we're not, running expenses through the county auditor, which can take a little bit longer sometimes to get people paid. So please watch for that information next Friday, September 24th. I apologize that we couldn't all roll it out at the same time, but honestly, just with timing and having to request permission from board members and kind of work through the process in the background, there's a little timing delay. But again, it's going to be effective September 1st, like Hamilton County's program is. So on the information that you receive, Amy Winkler, our provider relations coordinator, she'll remain the contact for questions on the different supports. However, I believe when you're submitting items, we're going to have them coming to our provider support desk email because we want a number of people to be able to access things and move them through the process timely. There'll be some parameters that you'll read about with the workforce support dollars. You can submit in all those categories. Adult day service agencies don't have access to all of the categories because some of them are very residential related. You can submit in all the categories that you'd like, but one submission per agency a month. So there's some parameters around it. We know it'll take a little bit to digest it, but please feel free to reach out with any questions that you have. And it's not nearly enough to help with everything that you're struggling with and that you're working on to keep folks that we serve safe and healthy. But hopefully it's a little bit of relief for, turnover and expenses that just are not covered by Medicaid. Does anybody have any questions for me at this point?
Yes, I do have a question want to ask. This is Emily.
Yes.
And thank you so much for the support program. You explained very well for us. I really appreciate county support or health support. I do serve Hamilton, so already starting all the paperwork for Hamilton. And I have some question when I prepare my provider serve for Hamilton. Since Butler also using the same the template, I just have a question when I actually doing the work. First of all, like a new hire and like a appreciation week, right? Cost is different. So when you say, hey, submit one form 1 month, so I need to combine everything together. Like appreciation week, I can finish this week, right? I need to buy something distribute, but do I need to wait for all this new hire, all the annual training finish, give it to you one, or you said, hey, appreciation week, I can finish one, and then for September, for the new hire and annual training, I can submit one, or you said, hey, just separately. That's my question, because I have to wait, because training is different, right? Each people, but also I heard about this, the first one, for first come, first serve. Okay, I spend the money, how I can guarantee, because I don't want to announce. Then they said, now I start in Hamilton, I tell, hey, finish the annual training. I will try to give you some bonus or whatever training. I cannot guarantee, because if first come, first serve, I don't know. It's hard to explain for me to provider, right, in the real work. So that's my question. Do I need finish everything only 1 month, one form, or I can separate? Appreciation week is one form, right? Training is one form. What I can do?
That's a great question. I'm reading the template from Hamilton County, and it says agency providers can request multiple reimbursements, but we ask you to limit requests to one request form per month. So yes, you could wait till the end of September and add in everything that you did in September on that form that would get you the reimbursement. So let's say the month of September, you've got your DSP stuff, you hired so many, you did, your annual training for this many, your renewal training for that many. And then, you submit it to us at the end of the month or at the beginning of October, and it's for the month prior.
Okay. Got it. Okay, got it. Thank you so much. I have the other question. Sorry, since I work, I probably have a more question. So I just try to ask. The other question is annual renewal, right? Each one have annual renewal. Each person have a lot of paperwork, right? So the annual DSP, annual training, they said I have to give the hiring date for new employee. So I guess that one I can use in I-9 form, right? So to say exactly effective date, I thinking I can send that documentation, right? Documentation of the date of hire for new. I can use in I-9 form. Documentation for training. Each person training probably 10, 15 pages for annual different training, right? On ISP training, MUI. Do I need a scan, or I need just make a certificate from agency? Hey, this one, finish this one. But all the detail normally I keep in the file for audit, right? So what documentation you need to support? That's my question, because again, each one have a 20. If I have a 20 provider, that's a 400 I need to scan. So
Right.
what I can do?
I think that if you provided us with certification indicating all and noting all the trainings that, not all the papers, but
yeah, that's what I'm thinking, right?
We're not looking to make this difficult on you, but we are asking you to attest to what you submit to us. So
okay,
if you as the agency are going to verify, here's the 3 employees and here's everything that, on one certificate that they, completed. I find that to be acceptable as long as you have the backup documentation.
Yes. Okay, thank you. I just keep the back, in the file for audit, but I don't need send every detail paper to the county, right? Okay.
Yes.
Great. Thank you so much. I really appreciate it. And the other question, sorry, the last question is DSP, right? Because our agency, right, we have like we have maybe 5 people for Butler, 10 people for Hamilton, right? So 5 people, but we do have a billing people, right? They are not actually, actually working on, but they do the billing, they do the office work, really support. Without them, they cannot do we cannot running, right, all the front end. So do they also call DSP can we call them? Because, all the building people, all the admin people, they collect data, do all this audit work, everything. They still actually work. Do they eligible get appreciation week, everything? That's my question also.
Well, the direct support professional role and what we're reimbursing for is all those who are directly providing care.
Okay.
I know that some of you do have office staff that have had to actually literally get whatever their credentials are to do it and get the training. If they function in a direct support professional role, then where they're providing Medicaid services and, obviously the training and such is not reimbursed for that, then they would fit into that. But we can't open it up beyond that at this point.
I see. Thank you.
You're welcome. I think I saw a question in the chat. I'm sorry, I'm trying to multitask. For independent providers, we actually have many of the supports that are outlined for reimbursement are for agency providers. We are open to having discussions on different ideas, and I think Hamilton County put the same thing in their template, that if you have something that is outside of this that you want to discuss, please reach out and let us know. It's mainly targeted at trying to stop the turnover, hopefully help with some of the retention and training that is going on for the agency providers. I know there'll be lots of questions. That's understandable. And, we need time to digest it and work through them. So, please watch for our email next Friday. We need to get all of our forms and everything figured out so that you have everything that you need when it does come out. The COVID relief stuff will look very familiar to you. It'll look the same. That's coming out this Friday, September 17th. The other email will come out next Friday, September 24th. And, we look forward to being able to help in some small way to hopefully make things a little bit easier for you. Appreciate all of you and thank you very much for your time.
Thanks, Lisa. I appreciate it. If anyone has questions on this, feel free to reach out. I'm going to drop my name and my contact information in the chat. I'm happy to help with that. And if there's nothing else in relation to that, we have Lisa Fry with us. We're really excited to have her. She's with Lifespan, and she's going to be going over the role of a guardian. So Lisa, whenever you're ready.
Okay. Thank you, everyone. I do appreciate all the direct care support, independent and agency staff. So I know this last 18 months has been, we've all had to extend a lot of grace and getting to know different people, new people, and people covering. So I do appreciate all that you do. I know it's very hard work, and I appreciate all of you. I'm going to do a brief presentation on what guardianship is and how it applies to our Lifespan Guardianship Agency. Just a little bit about who we are in my presentation. I did want to ask you guys, because I don't know everyone, are a lot of you independent providers or agency providers? Amy, would you know if there were most?
I see a good mix of both on here, I think, Lisa.
Okay.
Yeah.
Okay. I was just curious who our audience is today. So can you see this slide?
Not yet.
Okay. I didn't know if I had share capabilities, if that's on there.
I believe you do. Is it allowing you to hit the share screen button at the bottom?
Oh, okay. Let me do that. Sorry.
Oh yeah, no problem.
Share screen, that would help. Okay.
Here we go. Thank you.
Everyone see that? Okay, great. Thank you. Thank you for that. Sorry about that. So I was just going to let you know about our Lifespan Guardianship Program. We are part of Community First Solutions. And some of our, just a little bit of history about Lifespan. We merged with Community First Solutions in 2019, so it's just been about 2 years now. And Lifespan just celebrated our 75th anniversary. So we've been an established nonprofit since 1945. This is just a little bit about our agency, and CFS been around since 1918. And there's our visions and values. So the Lifespan Guardianship Program started, and we are a nonprofit agency started in Butler County in 1996. And these are a list of all of our different programs that we have at Lifespan. If some of you, maybe a lot of you may be familiar with this, or some of this might be new to you. So we do have our early service program through the levy dollars in Butler County, representative payee program, and they serve a 75-mile radius, so they can provide representative payee programs within the different county regions. And we also are in several school-based schools local to provide school-based support services with social workers in the schools. And this is an estimation of our last fiscal year about how many clients it impacted in our program. Getting down to the Lifespan Guardianship Program, we currently have 7 staff guardians, and there are 3 different levels of training. We served, move it over a bit so you guys can see, a total of 316 clients last year, and we were awarded 51 appointments of guardianships in the year 2021. We also have a volunteer guardianship program and friendly visitors. So we have about 11 volunteers. Some of the volunteers are legal guardians, and some of them are friendly volunteers where they go visit the clients along with the legal guardian, visit the clients monthly. So just a little bit about our program. We also have a part-time administrative assistant as well. All of our guardians, after a year of being a legal guardian, we follow the National Guardianship Standards and also the Council of Accreditation Standards. So those is a national organization. There's about 25 standards, and we all are certified, and all of our guardians are master or bachelor prepared program trained. Just a little background. So what is guardianship? I did did you guys get the handouts I sent earlier that Amy sent?
Yeah, we'll send those out in the meeting minutes.
Okay, I'll pull those up as well.
Mm-hmm.
So this just basically what guardianship is. I know if a lot of you are independent providers and maybe the guardian of your son or daughter or family member. We do have the opportunity in Butler, Warren, and Hamilton County to provide guardianship services for individuals. Sometimes is a last resort, or there's no one available to do that guardianship for the individual. So we do work with many people in the community to provide guardianship with. Our guardians do visit at least monthly, and I know with COVID, we have had to do a lot of virtual visits, as many of you have had to do as well, SSAs and everyone in all the programs. The last couple of months, we have been able to start seeing our clients, which is great. Seeing them either at their workshops or at their homes. Some of the things that our Lifespan guardians do is we attend their care conferences, the plans of care, oversight of services and needed supports. So we do like to work very closely with our providers, know what's going on with our clients. So it is helpful. I did note, and this is something with our training, a lot of times people are confused about why we don't do direct care supports and why we don't transport, as opposed to maybe a family member that has been able to provide that service. Our agency does not transport, and we don't, with our guardianship standards, we, as a professional guardian, we're not allowed to provide any direct care support, so that that's helpful. We are also on call 24/7. We have an emergency guardianship number as well. And I can share that. Let me stop this share and I'll pull up another one. This is a one of the charts that has our emergency on-call number. So if you are a provider of support of individuals that live in the community, this is something that's very helpful that we can provide that we always provide the providers is when we are in our regular office, who the guardian is, our emergency on-call number during normal business hours. Once lifespan guardians are appointed, they're the only person who can make decisions for the guardian under guardianship. And that's, I'm talking about medical decision making and assisting the client. We do encourage person-centered planning with the client. Some of the things, what we like to be appointed as the guardian, some of the things we like to know about the client is if there's any changes that occur in that client as well. So this just gives the provider a little sheet to like, hey, when do we call? What do we call about? What are some things that would be considered an emergency on here? If the client sent out to the hospital, it is good to have the letter of guardianship sent to the hospital, so that the hospital is where you guys know they have guardians and call us, but we like to talk obviously with the hospital and give consent to treat. So that's a little bit of, I think Amy will send out with the minutes. This is our main number for lifespan. If you can't get a hold of each of our guardians, have direct numbers. And then this is some of the non-emergent things you can leave on our voicemails that are secure. We also have a dedicated fax number that you can leave information like this on our fax. So just to encourage a lot of communication between our providers and the guardians. Back to my other screen here. Clues that a client may need a guardian. And this is some helpful information. A family or caregiver sees significant concern, the client's in decline or their mental capacity, incompetency, and decision making. I know there's we do encourage a supported decision making if an individual doesn't need a guardian. So, and I know the board has worked on lots of trainings, and I'm sure you guys as providers have learned a lot about that as well. How to, if an individual is able to make their own decision and they're getting the support from the individuals, that's also encouraged as an alternative to guardianship, and less restrictive. The client isn't engaging in services or refusing services. Current decision maker not making good decisions, or medical financial POAs, putting the person possibly at risk. And medical providers sometimes will, this is a good example of individuals that may be over 18, and the medical providers are questioning whether they should have a guardian or a medical decision maker to assist that person when they are going out into the medical field. Adult protective services, we get referrals from adult protective services in the community. So we do serve anyone 18 and up. And also sometimes they have court involvement. This is an example of our application. We have that online. And I'm going to, let me go back, previous, and share another form with you guys.
Hey, Lisa, it's
Yeah.
Kara. We
Uh-huh.
can't see the forms you're sharing. I just
Oh, you
wanted to
can?
know.
Okay, I will try and see if I can pull them up.
We can see that now.
You see that? Okay, I think I pushed the stop enable sign. So this is also a form that we worked on actually recently, and we kind of adapted it from a representative payee. When someone gets a rep payee and they're brand new, like what does a rep payee do? How do you take care of our bills and whatnot? We did the same thing for a guardian. So when we do get an appointment of guardianship, we would like to share this with our providers and family members, so they might not be really know what we do as a guardian and how we can support that individual. So that, and this will be sent out as well. So just basically, what are the duties of a guardian? So we do answer to the local probate court. We have to do guardians reports every year as well. And a lot of times we'll get a lot of that information from you guys as well, and along with the visits. Some of the limits to guardianship that guardian can't do is, as I mentioned, the transport and direct support, and that's through our agency. We do not manage finances of the individual. We typically, individuals have a rep payee or an estate to manage their finances. We do communicate with a lot of providers about what's going on with an individual, and if someone wants something, they'll usually the payee, the provider, and the SSA would talk about some things if someone really has a need. We also we can't give consent for specific procedures. We have to get court approval. And that would, an example of that would be a forced medication or an amputation, things that one of the great things about having the probate court available to us is that we can always go to them for any kind of tough questions or answers to individual situations that we're not really sure about, and how to manage the decision making for that. So that's helpful. Giving approval for forced meds. Let's see. Role of the guardian is to ensure their medical needs are met, that they have appropriate housing, work with the providers, and report any significant situations, respecting the rights and responsibilities of the individual. Any questions so far? And this form is helpful for new providers, letting you know who the guardian is assigned to the individual, and who the contact person is.
I have a quick question.
Oh, go ahead.
So for Butler County, I don't know how it is for Hamilton, but for Butler County, to, I guess, start the process of guardianship, it's all done online. It all has to be typed out. And I looked over the form. There are some gray areas for someone that's not really familiar with, I guess, different types of court, I guess these types of court legal papers. Can you advise on if they could possibly get some help, preferably like free help on properly filling out the forms so that it's not, so the process is not prolonged?
Yeah, that's a good question. We get that a lot, because I do get a lot of calls from individuals that are family members like, hey, I need help filling these forms out. We aren't allowed to give legal advice, and I typically do refer them back to the probate court, or there are free legal individual. I don't have the number with me right now. There is free legal advice you could call attorneys and get some information on that, because sometimes I agree it is, when you look at all those forms, there's a lot of them, and which ones are really needed in the situation and what is it. I do when we have an application, I know we have to have the application, obviously, and the expert evaluation, and in Butler County, it has to be typed and signed by a doctor, a physician, or psychiatrist for the initial guardianship. Yeah, that is a tough one, especially you got young ones getting, turning 18, and the family members just looking for some support. So that's a good question. But, typically, I encourage them to call the probate court. I know family members have come in with paperwork and that, oh, this one form's incorrect. So they will let them know that they have to adjust that form. Is that helpful?
A little.
Okay. Yeah.
Thank you.
Yeah.
Any other questions for Lisa?
Let me, I'm sorry, let me get the rest of this. Pull up the slide. I'll stop sharing that one. That's the PowerPoint, sorry. Put it up real quick.
And then Lisa mentioned I can send all of the information she just presented out in the meeting minutes after the meeting.
Yeah.
Lisa, did you have anything else to add?
Yeah, I was just gonna do the rest of my slide, but that's,
Oh,
yeah.
okay. Sorry, go
That's
ahead.
okay. Yeah.
Okay.
If you have time, if you don't, that's okay.
Absolutely, go ahead. Thank you.
Okay. I'm trying to pull this up and I've just lost it somewhere. Oh, sorry. You guys can't see my screen, can you?
Not
No.
right now.
Okay. Sorry. Pull that back up. Yeah, just a few more things here. Sorry about that. And so one of the things, if you can help, what can help to benefit each other is just reaching out with providers and communicating with everyone together when the guardianship gets in place. Any medical concerns, medication update listings, notify of any changes and follow-ups, any medical appointments. Sometimes providers might take an individual to a doctor and the client refuses, which is fine, but just letting us know that they didn't want to go get their blood work done. That's helpful for us as well. And then we are, like I said, the letters of guardianship are going to change. As of August of this year, letters of guardianship for probate courts in the state of Ohio, if an individual is a nonprofit, the agency is nonprofit, or allowed to be listed as a corporation. So if you have any of our clients in the system, we will be getting new letters of guardianship, and they'll be listed as Lifespan Incorporated instead of co-guardians. So we could, and this will be a big change for us, so that when people come and go in our agency, we don't have to go back to the court and get names changed on letters of guardianship. So it's similar to APSI, if you have seen APSI letters of guardianship for individuals as well. We still have the guardian's name specifically as the assigned client for the individual. And this is what Amy will also send out. So this is what a typical letter of guardianship will look like. And can you guys see this okay?
No, not that right now.
Okay, yeah, it's a little fuzzy, but that when I set the handouts, so that will be helpful. You can see what they look like. Any questions? Go ahead and stop sharing now. Any questions about guardianship? I know there's you know, with individual guardianships and agency guardians, it's a little bit different, but still have the same roles.
Thank you, Lisa, so much. We appreciate you coming
thank
and
you.
talking. Is it okay if anyone has questions to reach out to you?
Yeah, just reach out to me and we can work through the process if you have questions about guardianship in general.
Wonderful.
Be good. Thank you.
Yeah, thank you so much. We appreciate it. And then we were supposed to have Beth Reisner talk about the outcome tracking system. She unfortunately cannot be with us. She's going to kind of be one of the main people working with that, but I'll share a little bit of what I know. Let me try to share my screen. She sent in a document to review. Can everyone see that?
Yes.
Okay, perfect. Thank you. So outcome tracking system, essentially, and I'm sure a lot of you have probably heard of this. It's been out for a while for employment services. But essentially, it's capturing how people spend their days. They are adding ADS to that. Again, employment providers, ICFs, and DCs. So DODD, if you get those Memo Mondays, which are very helpful, they sent out some of this information, including these dates right here and times where you can kind of hop right on, you know, ask questions. They're there to kind of help support you through that process. So if you, I don't think you, we'll send this out, but I don't think you can click on these links. If you need this, let me know. I'll be more than happy to email that out to you. Or if you do receive Memo Mondays, it was sent on the September 6th Memo Monday. So kind of just a snapshot that's coming and is fairly new for ADS providers. So I will attach this to the meeting minutes. There's some more helpful information down there and kind of how to log in and access it and what to do. And if, as you have questions, feel free to reach out. I'm happy to help with that. And then Beth can kind of help as well. So I'm going to stop sharing that. And then essentially just several updates I have to share, and then I'm going to put the agenda up because that might be helpful. Okay, so just as a reminder with the provider portal, so that was launched April 1st. We're really excited about that. So all of our RFS are kind of housed inside of that portal, and I'm sure you guys have heard this before, but just as a reminder, it's there. If you have questions or have any issues logging in, accessing that, let me know. I'm happy to help. Something that is new, right here, we added an email feature. We thought it would be helpful for providers. Instead of having to log in every day to see if there's new requests, you will get a prompt and it's going to look something like this. Just saying that there is a new service request that you would be certified for. So just to help save some time, be a little more convenient. That way, if you're seeing these emails and kind of curious as to why, that's what that's all about. It's a new feature. It's just added about a week or so back. If you do not wish to work with any additional individuals, if you're just working with one or anything like that, let me know and I can kind of take that off so you stop receiving those emails. But that's kind of just wanted to review that new feature with the portal. A couple other things that came out in the Memo Mondays from DODD. The federal public health emergency was officially renewed. And so when Appendix K was approved, it included an additional 6 months of like unwinding time for those flexibilities. So now it's scheduled to expire on October 18th, unless that's renewed again. So that would allow that unwinding time of April 18th. So they just kind of push that all back. I do have the links down here for the actual public health emergency itself, and then Appendix K, which is quite a large document. I think it's like 56 pages of what all is involved in that. So if you feel free to log into, click on those links and learn more, or, reach out with any questions on that. And then another kind of DODD update, providers will resume full compliance with rules that apply to hiring and training DSPs. And so there's still going to be some flexibilities granted with that. And that's mostly around the initial training. And if you click that link, it kind of it'll break it down and tell you what initial trainings are going to be accepted through the end of this year. And then first aid CPR. And they are allowing the kind of to not have the end skills assessment at this time. That's going to kind of kickstart back in January. So we're going to allow that until January 1st, but that's all explained in the link here. Any questions so far on this? Okay. Next thing, and I know we've talked a whole lot about this lately, but September 1st, they officially kind of sent out that new rule for the provider certification. So they broke it into two. Previously, it was all in one rule. So here's the rule right here. This was for agency, and then we have independence right down here. The link will just, shoot you right over to that rule if you want to read it, look over that. We've had, I know, several Scott was with us last month from Opera to review what those changes are. But that did take effect September. There is one kind of update to provide with that. The trainings are not going to be available till January 1st. So for any kind of initial certification, or if you're doing your annual training, all of that will kind of be on and kickstart on January 1st in DODD. So don't worry about where to find that in My Learning. It's not published just yet. So they're taking some time on that. So everything's kind of in current place prior to this new rule. You can use those trainings. So that's kind of the one new thing that came out with that. And lastly, DODD does have grants available. So I just wanted to kind of publish information on that where you can go to learn more about that. So this link right down here will navigate you straight there. It'll talk about what they have available. And if you're interested in submitting, the email's right here. Just make sure you put in the subject line, all that information they're requesting right there. Any questions on any of that? I know it's a lot, I'm sorry. And then the last meeting for this year is November 17th. And I think we're going to kind of stick with virtual for now, for health and safety concerns. And then we're really hopeful moving forward kind of soon after to have a hybrid option available, so we can both be in person and have that virtual option, if that's helpful. So if there are no other questions.
Amy,
yeah.
Amy, can I make a comment about the DODD training for providers?
Yeah, thanks, Robin. Go ahead.
The curriculum is available for the new topics on My Learning, is available for download. If agencies would like to download that to use in their own training, that is available. It's quite a large amount of information, but that is available for agencies if they would like to start using that. They probably should start using that to train their staff. But as far as independent providers or anyone using what is in My Learning itself to do their training, that will not be available. The new training will not be available to use in My Learning until January. So curriculum itself is available for the new topics for agencies to take and use within their own training that they are going to use within their agencies.
Thank you, appreciate it.
Just wanted to clarify.
Yeah. I know that changed quite a bit, kind of as that
Yes,
rolled
it's
out.
very, very, very confusing right now.
Yeah.
So
Yeah. Anything else? Any other news anyone has? We really truly appreciate you being with us, and thank you so much for everything you do. And we're just really excited to celebrate DSP Appreciation Week. And if you ever have questions or need anything at all, feel free to reach out. I'm happy to help in any way. And we'll look forward to seeing you November 17th. So thank you so much. Have a great day.